Are you ready? Is everyone ready? Okay, I'm really excited to have everyone here and to include everyone on Zoom as well. I'm very excited for everyone that came. This is the ZAP Research Spotlight. This is our closing ceremony for the RAs who have been working with us for 12 weeks. They've been working very hard, and I'm very proud of their work. And I'm also excited to have them present their research today. It's very exciting. We're going to start with the agenda. I'll show you that. So I will start with the background and explanation of the deafhub and what we do there, plus Sharp, that program that we run during the summer. I'm going to explain more about that as well. And then I will turn it over to the RAs for their 3-minute quick presentation about their research that they've been doing this summer. And then once they're done, we will have a Q&A from the audience. You can ask questions about their work. And then to close, we will have awards. And that is the agenda for today. I'm really looking forward to it. Turning it over to Tiffany. She will explain the Deaf Hub background.
Hello, good morning, everyone. Good morning on Zoom. My name is Tiffany Panko, and I am the Executive Director for the Deaf Healthcare and Biomedical Sciences Hub, or the Deaf Hub. I'd like to give a brief background of what we do here at the Deaf Hub. We were established in 2022 because we wanted to promote more deaf scientists and more deaf healthcare professionals here. And how we do that is focusing on these three things here. We support pathways for students who want to enter healthcare careers and give them the support they need. We provide a network for deaf scientists and healthcare professionals. And we also do some, well, we don't directly support the deaf community, but we do some on the deaf community. We give them support through our research and for them to later become doctors and or PhDs. And next, I think you have yep. Okay, so we'll give a general overview of what we do. So we have two research labs right now. We have the Deaf Health Lab that I run, and then we have the REACH Lab, which is research and education on accessibility communication in healthcare. That is Dr. Jenny Rodriguez's lab. And then we have many different student programs. URISE and the Bridges program are unfortunately not active. We are looking for new funding to provide those, but they're still important. And then this is the SHARP program, and I'll let Jenna explain a little bit more about that. So we'll hold on that. And then we also have the SHARP Novice Interpreting program, which Jenna will also explain. And then we have MSSP, which is the Mentor Supported Shadowing program that focuses on, oh, I just realized I forgot to explain URISE and Bridges program. Those are for students who want to pursue a PhD in biomedical sciences, and we support them so that they can be a strong applicant for a PhD program. And then MSSP is similar, but it focuses on healthcare, people who want to become an MD or an NP or a sonographer or anything in general. We give them the opportunity to go and shadow professionals to see how they work in the real world. And if that's not their thing, then they have the opportunity to try more as well. And that gives a more clear idea. We also have Bright Idea. We are trying to grow representation in biomedical sciences throughout the Bright Idea and empower academics. That support focuses on BIPOC students and underrepresented students. We already have a very small amount of deaf scientists. Now imagine that BIPOC deaf population. So we're trying to support them to have more BIPOC deaf scientists. And now I'm going to turn it over to Jenna to talk a little bit more about SHARP.
Okay, thank you, Tiffany. Thank you. All right. I'm going to summarize some of these bullet points. And I'm going to expand on the SHARP program, the Summer Healthcare Academic Research Program. That's the sign we use for it. This is a summer program. It is 12 weeks. It's a work experience opportunity for any undergraduate students of any major, regardless what major they have, who are curious or haven't yet experienced research. They get a taste into it and see what it's like, or maybe they have some interest in healthcare topics. They can do research on that. They go through interviews, see what they're interested in, what their motivations are. And then we look at our available mentors to see what the best fit would be for them. We pair them up with mentors, and then they work on a research project throughout the summer for 12 weeks, and they present at the UJRS Undergraduate Research Symposium. That happened last week, and everyone did an amazing job. I'm very proud of the RAs. Now we're going to do a ZAP spotlight presentation, and you can see an even shorter version of their presentation about their work that they've been doing. That is a quick overview of the SHARP program. And I wanted to recognize and applaud those who work hard during the summer. We're going to start with the deafhub staff. As you can see, I am there with my wonderful lead RA, Emma Kane. She is wonderful. Applause to her. And then this is the access team. They do a wonderful job. I wanted to mention that there are two novice interpreters that we've been working with throughout the summer. They are also part of the SHARP program. We invite interpreters who have recently graduated from their ITPs, their interpreting programs, and they are motivated to work in research environment. And if they want to see what they look like, this is a great opportunity for those interpreters to get more experience. Here we have Emelina Trigo. I wanted to recognize her. And then the two novice interpreters are Kirsten and Josie. They're doing a great job. We wanted to recognize them. And then we have Kat Womack. Applause. She's a great interpreter. Okay, next. I also wanted to mention that the Deaf Hub has a lot more staff, but I can't mention all of them. So I'm just going to focus on those who are involved in the SHARP program at some level. I don't want to forget about the rest of the staff, though. They are important too. Here is Crystal Starks. Applause to her. And then we have Tiffany, the director. Yay. Now, these are the SHARP mentors and the SHARP research assistants. We have Camille Owlette over there. And unfortunately, Kira couldn't join us today. We really wish she could, but she has a situation that is preventing her from joining. But she did a lot of great work during the summer, and we still want to recognize all of her hard work. Even though she's not here, we still wanted to recognize her and give applause to her. Now we have Liz with her two research assistants that she works with. We have Tahiba and Harrison. Yay. Next, we have Brittany with Leanne. Applause to the two of them. Okay, I think next we're going to start with the first presentation. Okay, now we're going to have Harrison come up and present his 3-minute presentation.
Hello, everyone. My name is Harrison, and today I'll be presenting about stethoscope usage in deaf and hard of hearing and hearing users. Now, you know that typically when you go to the doctor's office, they use a stethoscope. But how do deaf doctors use stethoscopes if it is auditorily based? We did find some stethoscopes that deaf people can use that are digital, but of course, they do have their own problems. So we looked into that. Our research question is, how do we improve the current stethoscope usage for deaf and hard of hearing medical professionals? For our research project, we set up a survey and recruited deaf, hard of hearing, and hearing medical professionals and healthcare providers. It could be a doctor, a vet. All of them are welcome to take our survey. They took a short survey that asked them their experience using stethoscopes, what they liked, what they didn't like, and what should be improved. When the survey was finished, we looked through all of our data and we found deaf and hard of hearing professionals, and we invited all of the deaf and hard of hearing individuals for a short 30-minute interview that asked them about their experience based on their stethoscope usage, what they liked, what they didn't like, and what they would like to see improved in the future. In our interview, we found these three stethoscopes are the most popular with deaf medical professionals. Very cool. They all have Bluetooth connection that can connect to cochlear implants or hearing aids. They have visual data that you can store on an app on your phone to see later. And one of the stethoscopes has visual cues on the stethoscope itself, where you can see your heart rate and beats per minute, which is very nice. But one disadvantage is the price. Deaf tax is when deaf people use stethoscopes. These are very expensive, about $500. Deaf people have to pay $500 for the stethoscope, while hearing people pay maybe $100 to $300 for their stethoscope. So it's not very fair to the deaf professionals. Right now, we have found that the Echo Core 500 is the most popular with deaf professionals, but one major disadvantage is the price. So we are trying to find a solution for that and improve that stethoscope for the future, and maybe even create our own stethoscope model in the future for deaf professionals to use. Thank you.
I wanted to clarify that we will have a Q&A opportunity at the end once all of the projects are presented. Now, moving on to the next slide. Hi, everyone. My name is Brittany. My research has focused on BIPOC, deaf and hard of hearing students who went to deaf schools or mainstream schools. Deaf schools and mainstream schools are different. Deaf schools have deaf students in attendance. Everyone is deaf that goes there, while mainstream schools have a mixture of hearing students and deaf students together. My research question focuses on BIPOC, deaf and hard of hearing students and their experiences going to both of these schools, deaf and mainstream. Did they get their accommodations met or their needs met? What was their socialization like and their situations that they experienced? The methodology that we used was a survey, and we surveyed people who were BIPOC students who went to deaf or mainstream schools. There were 22 questions. We asked about their experiences in terms of advocacy, resources, and accommodations. For deaf education, we looked at people who went to deaf schools and if they had their accommodations met and their needs met, or did they experience any racism. For mainstream schools, we wanted to look at if they got accommodations for any classes that they took. Did they get accommodations when interacting with hearing peers? We also looked at extracurricular and social inclusion. Were they involved in clubs or activities, or did they experience racism with their hearing peers? This is what our flyer looked like. Again, we collected data through this survey, and the results that we found are that at deaf schools, many students experience a lot of racism. And then at mainstream schools, they faced their accommodations not being met. And at most mainstream schools, at deaf schools, BIPOC students felt like they were excluded from social gatherings. And then at mainstream schools, they felt like their needs weren't met and the accommodations weren't met. At deaf schools, people faced racism when they went to things like clubs where they weren't accepted because of their skin color. As for future directions, we hope to collect more data and have more people take the survey. And so we have more results to show deaf and mainstream schools that improvements need to be made for their BIPOC, deaf, and hard of hearing students in terms of accessibility and meeting their needs. All right, applause. Now we will have the last presenter present their slide.
Everyone, my name is Tahiba, and my research is about how healthcare training programs don't often teach about inclusive practices, which makes healthcare professionals struggle to interact with different types of patients. My research addresses two questions. The first question is, how well do healthcare training programs prepare professionals to interact with deaf and hard of hearing patients? And my second question is, what improvements can deaf and hard of hearing individuals suggest so that future healthcare training programs can include more inclusive communication and care practices? Moving on to the background, many facilities don't meet the Americans with Disabilities Act, and one study found that 40% of patients lack understanding of their health, and this is all due to miscommunication. And because of this, this can lead to major health consequences. And moving on to the mixed method, my target population was healthcare professionals and students who are currently enrolled in a healthcare training program or have graduated from one. Participants have to be 18 years or older. And after completing the survey, participants can choose to either participate in a 30-minute Zoom interview or complete 6 open-ended questions via the survey. And my qualitative results, a lot of participants say that there needs to be mandatory ASL training and more hands-on experience communicating with different types of patients because they feel that healthcare training programs don't simulate real-world patient interactions. And there's a lot of bias that deaf healthcare professionals face. They experience a lot of ableism, which is where they're often looked down on for their expertise because of their disability. There's a regional gap where Rochester has more cultural awareness compared to other areas, and this is due to the Deaf Strong program in University of Rochester. And so other regions may not have enough exposure to deaf culture and different communication needs. Moving on to my graph, I have more participants who are healthcare professionals than students, and a lot of them are from Rochester. So this makes that the data skew is present because the findings are not very generalized, but my findings support that deaf and hard of hearing individuals have more cultural awareness compared to their hearing peers. And this is a QR code for my references, and more inclusive practices need to be adopted so that we can fully protect our patients, but also make them feel more comfortable. And thank you.
Now we're going to move on to our Q&A. People in the room and anyone on Zoom can ask questions for any of the RAs about their research. You can raise a hand if you're in the room or ask a question on Zoom, and we can copy sign for you if you need. So are there any questions? For the last presentation, you had 3 graphs. What are the 3 graphs? How many total points is each graph? Or how many people that you surveyed did the interviews?
In total, there were 29 participants who completed the survey. And by the time I reported my data, I had about 3 participants who agreed to an interview.
Okay, first question from Jessica Contreras. She says, "You did a great presentation. You learned a lot through the summer and did you learn a lot about your research project through the summer? And what is your biggest lesson that you learned during the summer? What is your biggest lesson that you learned during the summer during your research during your research?" For me, I learned that I should submit my IRB application very early because I submitted it later and then I didn't have enough time to collect all of my data that I needed. So if I submitted it earlier, I would have more time to collect data and I'd have better results for my project.
I learned that completing an IRB application is really important so that research can be ethical. But there is a lot of work that goes into submitting your research and getting it approved. It's a long process. I believe it took me and Harrison about since May, and then it got approved in July. So it is a pretty lengthy process.
Yeah, definitely. You Things you didn't expect that happen. Brittany is saying, I would say for IRB approval, submit that earlier because I only had a few weeks left to send out the survey and I didn't have a lot of time to put all my data together. Looking back, I wish I had more specific questions so that next time I would have better results. I think there's a next question.
All right, the next question is from Tim Dye. And he said, wonderful presentations, thank you. If there's time, I wonder if each trainee could describe what the process of conducting their research was like. What worked well? What were the challenges? And what was the overall experience like? So you touched on the IRB. Could you talk about a little bit more about your summer experience?
Harrison is saying, could you repeat the question? Jenna said, sure. Can you describe what the process of research was like? What worked well for you? What were the challenges? What was that experience like for you? Harrison will come up to the screen. This was my first research experience, so it was definitely a learning curve for me. I think something that worked well was that I had marketing skills and skills to disperse my survey to different people. I could use my marketing skills for that, which worked well. And a challenge was finding deaf and hard of hearing providers because there are a lot in Rochester, yes, but I'm curious about people who aren't in Rochester, people who are in other states, their experience too. It was challenging to find those people. But a big thank you to Liz for her network. I got to spread my survey that way through her network. Yeah. Jenna is saying, Brittany or Tiba, would you like to talk about your experience?
This was also my first research project. And during the first few weeks, I had a lot of questions. But I think with research, it's a lot about just going through the process and learning as you go. That's the beauty of it. I'd say a positive of the program. I think because my major focuses on a lot of like data analysis and data collection, that helped me find ways to compile data with such a short amount of time. And I was able to record data a lot of the times. But the survey platform, I used RedCap. All of us used RedCap. That was quite quite the learning curve at first, but like any software, you just have to keep using it and get better at it. But yeah, definitely learned like the positive and the challenges that RedCap has. But a challenge of the program I had, I really wish I had more time to get closer with everyone and get to know everyone. But it is such a short amount of time, and I definitely wished the IRB was submitted sooner. But again, since it was our first time submitting an IRB, so of course it took us longer. But for next time, maybe not as much because we're more familiar with it. Thank you.
Any more questions? Anyone in the room? Brittany, do you want to share your response? No? Okay. Todd has a question. Todd is saying, are the three of you going to continue research or hopefully publish it in the future? Jenna is asking, do any of you want to answer that? Harrison is saying, for me, personally, I would not continue doing my research. Liz will continue doing the research for me because I'm busy with school and other commitments. But if I'm available during the spring semester, I would be happy to come back and work here and continue that research. Jenna's asking anyone else? Tahiba?
I would also like to continue doing my research, but as Harrison mentioned, I also have a lot of schoolwork and I'm going to graduate in 2026, fingers crossed. So because of all my course load, I don't know how much time I'll have, but if I am available, I would definitely love to come work here again and potentially have my research published so that it could be in a greater scale.
Jenna is asking Brittany, do you want to say something? Brittany is saying, no, I don't think I'll continue my research moving forward, but I think Leanne and other people will be interested in continue it. And if I'm free in the future, I would love to help them continue that research. Jenna is saying, great, I think I have one more question.
Great. This is Jessica Contreras saying, completely agree with Tim. And I would like to know what inspired your research topics and how your mentors supported your development.
That's a great question, says Jenna.
Can I answer first? Okay.
Sorry, we just need the interpreter to come up here quickly.
This research project that I'm doing, it was suggested by Liz first, but as I looked more into it, I realized how it connects to my personal experience and what I have experienced in healthcare, where I have met healthcare providers who are not very culturally competent, I guess is the word, that they don't have enough cultural awareness or working with like different types of people from different backgrounds. So I have experienced that, and I also had low health knowledge when I first came here because English is my second language. So I can, because from that lived experience, I can understand like why, in a way, deaf and hard of hearing patients like struggle to communicate to their providers, and bridging that communication gap, but also improving the systematic barriers with it with my research is something that I really appreciated the chance to look into.
Awesome. Okay. Anyone else want to answer that? This is Harrison. I think in the start of this summer in the SHARP program, I really had no idea what to do. because I'm a marketing major and this is a healthcare focused area. So I was like, how do I even integrate both of those things into one project? I had no idea what to do. And I was thinking like something marketing specific, like a product or making a specific product. I was not sure what. And then Liz threw out the idea of saying, hey, why don't we try to do something with digital stethoscopes? Because she was already thinking about doing something related to digital stethoscopes. So I was like, sure, why not? And it is a product or something that I can market and promote awareness for deaf healthcare and deaf professionals in the community. So we did that, and wow, there are a lot of things that I did not know before coming into this project, like the cost of stethoscopes and the deaf tax, and I really had no idea about anything related to that. So this was a really great experience, and I really benefited from that. Thank you. Brittany, would you like to add anything? This is Brittany. When I first started working here, I really had no idea what to do. And Leanne threw out the idea of doing BIPOC students in high school. So I said, oh, we could do deaf schools and mainstream schools and compare both of those. So I started doing the research for that, and I found it very interesting. But I wouldn't be here without Leanne, and I learned a lot from her. So that's a wonderful answer. Thank you, Brittany. Tiffany is asking for the time. Oh, yes, we have plenty of time. Tiffany's going to come up and say a few words. Harrison maybe already answered my next question, but my question is, I noticed the three of you have different backgrounds and you have varying majors. So I'm curious how your major helped you with your research and maybe vice versa, how your research helped your major and your studies, if you don't mind saying a little bit about that. Just a moment while the interpreter comes up.
Yeah, originally, filling out red cap and getting participants, I think it helps having data analysis background because you're able to find out ways on like how to compile the data faster, but also give data meaning. Like all those graphs, in the end, they're just numbers and pictures, but you have to find a way to best represent that and have that align with your research, which is exactly what my major is. And I do a lot of presentations. So I think and also communicating with a wider audience, it helps. Like that's where my major comes into play. What was the next part of the question? I don't remember.
How did your research help your major?
Oh, about that. I'm doing capstone next semester, and I think creating a software for healthcare providers that so that they can flag deaf and hard of hearing patients and give them more options to have an in-person interpreter or just state their communication preference is definitely something that I can do for my capstone project. Hopefully, I don't know what the professor will like have or like if they have any like rules, but if they don't, then that's definitely something I would love to explore.
That is very cool, says Jenna. Okay, does anyone else have something to say? I already answered the first part of your question a little bit, but I can answer the second part of your question of how the research applies to my major. Like what Tahiba just mentioned, as for RedCap really helped me a lot. For example, how to make a survey, how to disseminate a survey, and how to read data and quantitative data from a survey and actually understand it and be able to apply it. So that is an amazing tool for marketing analysis. If I'm running a website, I can use the research experience I got from here on my co-op and apply that to my website data and how many visitors we had, how many impressions it made on different things. So that was very beneficial. And not only that, but before I did this program, I envisioned marketing for like a big business or a business in general, and I never thought about marketing for healthcare because I didn't even think that was a thing. But no, healthcare marketing is a thing, and how it's really opened my eyes to how many things I can do with marketing, not just business. It can be in healthcare too. So that was very nice to see. Brittany, do you have anything to add? My major is pretty different from research, but the research was nice to help me understand REDCap, and REDCap is perfect because I have my capstone coming up in the future. And it was not just that. My major is pretty coding focused, so after work, I thought, oh, do I like working with humans too? And I want to do research and work with people. So that kind of changed my mind and what I envision for the future. That's wonderful, said Jenna. Okay, do we have any more questions? Todd has a quick question. For the digital stethoscopes, does that save and record data so that you can compare it in the future, the measurements again? Harrison says, yeah, the Echo Core 500 has an app that you can download on your phone. And then when you use the stethoscope, you can see the beats per minute and the heart waves on there. And then you can transfer that data to an app to keep all that data for the specific patient. And then you can use that in the future. Yep. This is Jenna. Okay, I think that's all. I'm just going to make sure there's no more questions in the chat. Okay, beautiful. So now we're going to move on to the exciting part, which is the awards. And I really want to recognize all of the hard work that all of you have done so far this summer. So we're going to move on to the next slide. This is Emma. Woo! So her award is the Blooming Leader Award. I really just wanted to say I'm really proud of you. I've been working with you for the last few years, and I can definitely see your growth as a leader, especially this summer. I really empowered you with some different tasks and doing projects, and I handed it over to you, and you really took it in stride and you ran with it and you were not afraid. So I'm very impressed. And not only that, but you did a report of what you've learned so far this summer, what challenges you faced, and what worked well, and gave it to me. And I never even asked for that report, but she still thought, oh, this would be nice, and gave it to me. So, wow, I was really impressed with her. And it's really wonderful to see her growth in the last few years. And I look forward to your last year with us. Also, I'm not looking forward to you graduating, but all right, now we'll move on to the next slide. Okay, Cami, do you want to come up and say a few words about Kira? I know she's not here today, but still, I just want to take a moment to recognize her.
This is Kira. She doesn't have a sign name yet. In deaf culture, sign names are very important. It represents who you are. So I've been thinking about a name sign for Kira, and I've decided on this. And there are 3 reasons why. Ready? Oh, the first one is she's ready. The second one is finish. And the third one is go. And the first day, she was doing the city training. She was reading. You remember that was a fun training, right? And they said, sure, yeah. But they were doing the city training. And I said, once you're finished, go ahead and use Google Scholar to read some articles from Tiffany's work that she's been doing to see what the Deaf Hub has been working on. And the next day, she has a Google Doc filled completely with different research questions, different information that she wrote down. And I said, okay, what area do you want to focus on? And her answer, I thought her answer would be, oh, deaf healthcare access, something really broad. But no, she already wanted to do something really specific, communication aspects, access for deaf healthcare, deaf patients in healthcare. And if they did receive that access, like from a doctor, did they receive advocacy? Did that patient get advocated for? And if the doctor said yes, I got an interpreter, but did the patient ask for an interpreter? So she had a research question ready right away. And I know there have been a lot of complaints about the IRB, a lot of problems. And I was concerned because when the IRB got back, Kira was on vacation that week that the IRBs got sent back and approved. When she got back, she said, "Oh, I see. I already emailed them that I'm on vacation. I already emailed them while I was on vacation." And so earlier in the week, she was sick, which was really awful. But she still went to UGRS the same week of the symposium. And I said, "No, you can stay home." But no, she went and she did an amazing job that week. She's done a lot of hard work this summer, which is very impressive. She is the most motivated of all of them. I'm sorry, but she is the most motivated of all of them. Yeah.
Okay, next is Liz. Be careful of the cord here on the ground. Okay, so hello everyone. I had the honor and pleasure to work with Harrison, and because his project focuses on stethoscopes, and he's really an expert at filtering out data and looking at all of that. And I asked him to run a marketing analysis and what stethoscopes are out there, what the market what looks like. And he identified over 150 brands of stethoscopes, but 4 that were accessible to the deaf and hard of hearing community. So then he focused on those 4 and analyzed all of that and identified what could be improved and what needs to be fixed and what could be beneficial, not just for deaf and hard of hearing, but also general users too. Because some environments are very loud in the healthcare community, it's very hard to focus and hear on the different noises. So he was making that more accessible to see the visual wave on the stethoscope. So that is his name, the silent oscillator, because we are dependent on signals without sound, right? All right. Congratulations, Harrison. Okay, next.
Brittany, when I first met her, I thought, "Oh, she's so sweet and cute. And she's so mousy." Actually, no, she proved me wrong because during EYF, it's a program here at NTID. It's in this room. It's high school students, and they can be, very rowdy. But that girl was relentless. She was managing the classroom, had everyone paying attention, and I was shocked. At the same time, she is very studious. She worked hard and she figured out what she wanted to do next. When she figured out what she wanted to do next, she would do it. She would figure out all of the steps in her plan and she would just go down a long rabbit hole. And then she would climb out and say, "Hi, I'm done." And I'd say, "Wow." And that's why I thought she's the most studious person and researcher I've ever met, ever worked with. And it's nice to have her as my mentee, as my research assistant.
Brittany said thank you. All right, next. Liz again. Hello again. I had the blessing of having 2 amazing research assistants to work with this summer. First, Tahiba. I mean, when I was introduced to Tahiba, I did come up with her name sign. She has 2 big characteristics. I love her hair. She has thick, wavy, long hair, and she has a cool streak in her hair of a blonde streak that makes me think of her independent streak that she has. So her last name starts with R. So we made her sign name Tahiba here on the chest. And her award is the Red Cap Whisperer. Wow. you blew all of us away. And everyone mentioned that RedCap is new. This is the first time that we've used it. Big thank you to Jenna for your practice and your help. It would not have been possible without you. And Tahiba's project is a little bit complicated. It involved both deaf and not deaf students and professionals. And when we were going through the questions, we realized, oh, there's two different pathways that they should be able to take. So we had to develop the branching logic within the survey. And it was a little bit complex because when you answer a question, you can go to either of those questions. And then if you answer those, it can go back to one question. And if you're not deaf, it would stop the survey. And if you are deaf, it would continue the survey. So needless to say, it was a little complicated. And Jenna is a huge blessing and helped us a lot with that survey too. But the outcome and the product that we had was just wow. And we had so much amazing data from that survey. And it led to our interviews, and that we were able to interview 3 people. But she was not satisfied, or the time ran out, and we will continue this project going forward. But again, I just want to congratulate her as the Red Cap Whisperer and the expert.
This is Josie. Josie is very quiet. She's kind of hidden in the back. It's funny, she's interpreting for her award for herself right now, just letting everyone know. But even though she is quiet and very humble, she still does an amazing job and has been great this summer. It's been great for both of us to see her growth and development and her acceptance of new challenges. And sometimes she is more. That's a good question for this sign. Yeah. She's more stone-faced.
Stoic.
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 Anything to add, Emily? Same. Yeah, I enjoyed the beginning of the program, trying to figure out who Josie is. I know her skill was there, of course, but trying to bring out her personality a little bit more. And she is quiet, but she is skilled.
All right, thank you. We can do the next slide. Kirsten original award was a little bit too long, so we had to shorten it down. But this is from her ability to always be ready. If you say, oh, if you want more details, we can give it to you. But she's always like, oh, sure, I'll do it. It's always sure, sure. She's like, oh, do you want to do this? And she'll say, I don't know, but okay, sure. She's always ready and willing to support and take on the challenge. Yeah, I think she's very social. She really dove in with staff, faculty, and the students. She's really sociable, and she's able to dive into work and be sociable too. Congratulations, everyone. We really had a great summer, and it was a wonderful experience working with all of you. You're really a great group, and I want to recognize all of your hard work, all of your growth, and we look forward to seeing your journey after this summer is over. And I hope you know you are automatically a part of the Deaf Hub family, so please don't be a stranger. Visit us at any time going forward. We're always here to support you in the future. So that wraps up everything. Thank you all for coming, and thank you all on Zoom for joining us. I really appreciated taking the time to see your hard work and celebrate. Congratulations, everyone. Thank you.